So speaking about sexual problems that may be caused by menopause, if a woman is experiencing sexual discomfort, are there some recommendations you could make for them?
Yeah, so there's certainly some easy things that can be done. Just from a daily basis, there's vaginal moisturizers. So those exist that are just separate to use, with intercourse, but on your own. So it's kind of like using a lotion for your skin. So they make similar products that are used for vaginal health that's used on more either a daily basis or every other day basis. And so that's helpful more for just, women at maintenance unrelated to having intercourse. With intercourse, it's really important to have a good lubricant. So that really can't be overstated. If you're menopausal and the vagina is naturally a little bit more dry, less elastic, a little bit smaller. So there's some things that can be used just even in the grocery store. So olive oil is actually a really nice lubricant that will not increase vaginal infections. Coconut oil, also you can find at, your grocery store, and a lot of women use too. That certainly delves into, there's prescription medications to treat the underlying issues as well as some really great water and then silicone-based lubricants. I'm personally a fan of the silicone-based lubricants for patients. I think they last longer, they're nicer, but those are all over the counter, options that patients can kind of trial error, that women can try, see what works with them so that they can have a more enjoyable sexual experience.
So it sounds like there's lots of options.
Lots of options.
And thank you for the clarification between moisturizer and lubricant.
Yeah. Exactly. Yeah. So moisturizer is more kind of like lotion to your skin is how I, describe it to my patients versus the lubricants, which, are very, very helpful when used with each active intercourse. I will say, especially for some of our perimenopausal or not quite menopausal patients that may still have to, consider birth control options too, it would be important if you picked an oil-based lubricant to understand that those can interact with condom use. So just something to think about as we think about, we think menopause, inability to get pregnant, but as you lead through that transition, you still have to think about the products you're adding, if that affects your other birth control or medications. So it's definitely, worthy of an expanded discussion with your doctor.
It really is. I'm learning so much.
Yeah.
Dr. Kevin, I did not know those details.
Yeah.